slides. That is my cue that we'll go ahead and get started today. Thank you again, everyone, for joining us. Again, my name is Lori Christenson, and I'm the Gallatin City County Health Department Health Officer. And I'm going to go ahead and start with our surveillance reports. Give me a second, do a screen share. All right, let's start at the top, not at the bottom. Okay, so I wanted to share that we have seen a bit of an uptick in our daily and 7-day average COVID-19 cases per 100,000. So we were right around 12.4 cases per 100,000 as of last report. Right now we're about 17.9 cases per 100,000. And at the wanted to just clarify this again. Remember, this is an average versus the cumulative that is used to, that CDC has recommended we use to estimate our community transmission. So when we're looking at community transmission and the criteria set for determining if we're in high or substantial transmission, we're looking at the cumulative cases. So not the average cases, the cumulative cases. And a really easy way to calculate the cumulative cases is to multiply this average cases by 7. So you'll get a good estimate of where we are in terms of cumulative cases over the course of the last 7 days per 100,000 people. So I just really wanted to clarify that and just give a little bit of information and background about how those numbers are calculated. Moving into our daily and 7-day average percent positive, not surprising, we are seeing a bit of an uptick in the number of the percent positivity rate in the last 7 days. I also want to say that we are seeing an increase in testing too. So just kind of hand in hand, just wanted to explain that. Good news is we continue to be able to get that median time from specimen collection back to public health. That is a really quick turnaround still. That median time is still 1 day. So that is really good news. Moving on to our vaccinations. This is again for 1 dose per age group. We are seeing an increase. This is wonderful news. Over the last few weeks, we have seen an uptick in the number of individuals who are getting their first dose. So again, this is good news. We have a ways to go, so continue to get vaccinated. And also moving into, this is new, a new table we added during our last surveillance report where we are considered in that high transmission. And just to reiterate, when we're in high transmission, it is recommended that individuals, whether you're vaccinated or not vaccinated, to wear a mask in indoor settings. This was the same guidance we provided when we were in substantial transmission and remains the same for high transmission. Just means we have more cases and more community transmission in our community at this time. So I will stop sharing my screen there and kick it over to Kallie to talk a little bit about Bozeman Health.
Thank you so much, Lori. Let's see here. So for those of you who I haven't met yet, I'm Kallie. I'm Bozeman Health Incident Command Lead. Thanks so much for joining us today. I do have a short update for you all. Currently, we have 10 hospitalized patients confirmed positive for COVID-19. There was one point this week where we had 15 positive patients in our hospital here at Deaconess Hospital. We did have 1 positive patient in our Big Sky Medical Center. So we are seeing increased numbers throughout our health system for hospitalized patients. We also have experienced triple volumes in our urgent care settings for patients seeking care and treatment, with the majority of those being related to respiratory illness. We know right now that vaccines are the best tool we currently have to help fight the COVID-19 pandemic and reduce severe symptoms. We know that masking helps, social distancing helps, Hand washing helps and is always such an important hygienic measure year round. And over the past 18 months, every member of our Bozeman Health team has gone above and beyond to provide the best possible care in every situation to the patients of our community. And so we're continuing to ask for your help. We need your help in preventing the spread of COVID-19 in this community. We're asking those to get vaccinated to ensure that we all remain as healthy and well as possible. We are continuing to offer vaccines through Bozeman Health. You can find information on how to get vaccinated on our website at bozemanhealth.org, or folks can call our COVID-19 hotline at 406-414-2619. And also, if anyone is feeling that they need to be tested for COVID-19, they can call our COVID hotline, which again is 406-414-2619. They can contact their primary care provider, or they can present to any of our B2 urgent care or micro care locations throughout Bozeman, Belgrade, and in Big Sky. We also continue to provide telehealth services for individuals who wish to see their provider remotely. And so we would urge people or recommend, if they do want to see their provider remotely, that they contact their provider's office to inquire about their particular telehealth options on a case-by-case basis. I do have Dr. Hartnett here, who is our Quality and Safety Officer for Bozeman Health. I also have Dr. Andrew Sullivan, who is a pulmonologist and critical care intensivist for Bozeman Health as well. So they will be answering questions and providing additional insight on the current situation at Bozeman Health. Thank you.
All right, Tracy, any updates?
Vaccinate, vaccinate, vaccinate. That's our message to students. A week ago today, we launched an incentive program to incentivize students to get vaccinated. And I don't have numbers today, but by Tuesday night, we had 1,000 students who had entered, and they can only enter if they provide proof that they have been vaccinated. So that's pretty encouraging, given that that was just the first 5 days of the program, and that most of our students aren't here on campus. So we continue to push that vaccination incentive program, which, just to clarify, what it is a student will get $10 for registering. That's the only immediate incentive, which is somewhat less than the Town Pump gift card incentive program that occurred earlier in the year. But then they're entered into a sweepstakes for drawing for other prizes. But we continue to push very heavily that message to encourage students to get vaccinated, because that's by far the most powerful tool that we have at our disposal. We have reiterated the CDC guidance on masking indoors. We continue to have testing available here on campus, as well as easy access to vaccinations. So that's where we're at today.
Great, thank you. And I appreciate those updates, and it reminded me that I also wanted to share another quick update in terms of some opportunities we have for walk-in back to school clinics. Holly, would you mind just quickly sharing your screen so that I can walk through where to find that information? Thanks. Okay. So the health department is going to be hosting a series of walk-in back to school vaccination clinics with a COVID-19 option for those that are 12 and older. So we typically have provided school vaccination clinics for other routine childhood vaccinations. So this year I'll be offering Pfizer, and we will have some Johnson & Johnson available for those who are eligible. And parents and guardians can also receive a COVID-19 vaccine at this time. So we have the information about the clinic dates and times But I wanted to make sure that that information was available and could be widely shared in terms of encouraging those routine vaccinations as well as COVID-19 vaccinations as kids and families head back into school or thinking about going back into school as well. And with that, I don't have any other updates. We can go ahead and open it up to questions. Any questions out there today?
Hey everyone, my name is Juliana. I'm over at the Bozeman Chronicle. I had a couple of questions, and some of them might be kind of dumb, but that's okay. I guess first question probably for you, Lori. I'm curious. I know we have the mask recommendation now with the CDC guidelines, but I'm curious if cases continue, if you're going to further and make any other recommendations similar to what we saw last year with, our business hours and restaurant capacity and all that fun, all that very fun stuff.
Sure. I think, at this point in time, we're sticking with the prevention messages that we've shared so far with the community, which is wearing a mask indoors, as well as seeking a vaccine, as well as encouraging folks to get tested if they're displaying any symptoms. And of course, the frequently washing your hands message as well is going to be really important. So at this point in time, our department continues to be really focused on those educational and informational resources we have available at this time.
Cool. Thank you. And then I'm not sure who this necessarily would be for, but I know people have a lot of questions about the Delta variant just because it's so new. And now that we've kind of found out that vaccinated people can get sick as well. And I had a question, at least with all these people getting sick and maybe having symptoms, if there's different beginning symptoms with the Delta variant rather than the typical strain of COVID, if there's anything else people should be looking out for, when they're feeling sick.
Dr. Sullivan.
Yeah, I'd love to answer that. The vaccine is absolutely protective against the Delta variant. And the Delta variant is more communicable. It's easier to pass around between people. It's not necessarily more virulent. It may turn out to be that we get that information, but it's kind of going to create its own new disaster just because it's more communicable, that we're going to get hit with a lot more people sooner who become severely ill or critically ill with COVID because it so rapidly spreads. But the vaccine is still effective. It's still 95% effective for preventing severe disease and death. So getting the vaccine will protect you from getting severe disease or death from the Delta variant.
Mm-hmm.
And so any thought out there that the vaccine is not useful against the Delta variant is not true, and it's harmful if it's preventing people from getting the vaccine. So if anything, the Delta variant is a reason that you should more aggressively seek the vaccine if you haven't already.
Sure. I guess that's a good follow-up question. I know some of the studies that the CDC released last week, I think was kind of confusing for some people, especially the part where it said that vaccinated people could spread.
Yeah.
Could spread it. Could you kind of explain? Because I've seen a couple different things where there was, articles that it could be spread just as easily by vaccinated folks, and then some that said it couldn't be. And I think that's kind of confusing for people.
Yeah. So it's a hard thing to know.
Okay.
But I think what we've come to terms with is that the vaccine is life-saving for those who are vaccinated. We were hoping that it would reduce transmission, but there certainly is the phenomena, we shouldn't be that surprised by it, that people still get infected. They just don't get sick. And so they're out there feeling fine, but are actually actively infected with the Delta variant and they're spreading it on. Whether to fine tune it about if you're less infectious or not is hard to determine. It's harder to determine than non-infectious or not. So we do know that you could still be infectious, asymptomatic, or symptomatic if you've gotten the vaccine. And that's the whole idea of that, hey, we got to put masks back on in the appropriate settings because you may be asymptomatically spreading it. And the people at most risk are you're doing that to protect the people who are immunocompromised or didn't get the vaccine. And so again, I think the CDC's done a good job. People are frustrated because they feel like they're changing their message, but they have to change their message because we get new information. I mean, that's just part of living in a world where we're analyzing scientific data. As new things come up and the message will change, and it's disconcerting, and I think it causes disbelief, but it should not change the message that has not changed an ounce of how protective the vaccine is to you as an individual. And that if you want to protect somebody else in the community, a loved one, it's still worth who is immunocompromised or hasn't had the vaccine, you having the vaccine probably helps protect them as well. But getting the vaccine protects you. It protects your medical community. We talked about the number of admissions that we had, 15 admissions at one point next week. That's in a 100-bed hospital. We have 20 critical care units in our hospital. 20 critical care beds in our unit in the hospital. At one point, we had 6 of those patients. A third of those were COVID patients. So, with this mini spike, we've already occupied a third of our ICU beds. And so, how this can turn out to be a public health disaster is we could fill up all our critical care beds with COVID patients very easily still. And then if you get COVID or you get any other problem, life-threatening trauma, a heart attack, a stroke requiring thrombolysis, we won't have an ICU bed for you, if we don't keep this under control.
Thank you for that answer. I know I talked to Kallie earlier this week about kind of what the hospital was, or Bozeman Health was doing with this new spike, but I'm curious with all these hospitalizations, I guess how hospital capacity is, if there's any plans to kind of increase or just kind of stick it out and see how the next couple of weeks are going and stuff, if that question makes sense.
Yeah, it definitely makes sense, which is one of the reasons why we stood up our incident command again and declared an incident, was the rise in the respiratory ill that we're seeing, but also knowing that we have been at increased capacity throughout the summer. We are, and I know that Dr. Sullivan can speak to this very well, the amount of burden that those high occupancy and high volumes have been having on our care team is significant. And so we wanted to bring together our incident command so that we could definitely support the team in a way that they can remain resilient and continue to sustain the high volumes that we're seeing, not only with COVID patients, but just in general, all of the other needs this community has from a healthcare standpoint. As far as volume goes, we are only seeing the volumes that I shared with you, but if you look at the percentage of our patients, we were at a 20% of our hospitalized patients this week were COVID positive patients. So that's significant in on our medical unit, we don't keep them on our surgical unit, but definitely on our medical unit as well as our critical care unit. 20% of the patients, 20% of our occupancy is COVID positive patients. And we are at last year, when we saw such a trajectory of increased hospitalizations because of COVID, we developed contingency plans throughout our facility to, if needed, to alter other spaces that don't normally house hospitalized patients, to be able to put hospitalized patients if needed in a surge capacity. So those would be areas like our post-anesthesia care unit, our interventional radiology unit, and other units throughout the hospital that don't normally house hospitalized patients. We have plans for using those if needed. But that would be if no other facilities were accepting patients. So we would continue to divert and transfer patients throughout the state and the region until they were no longer accepting. And then we would start going into that surge mode within this facility, which would be highly challenging.
So yesterday, the state had their analysis, which kind of laid out that I think it was 79% or 80% was unvaccinated of the new cases and hospitalizations were unvaccinated individuals. I'm curious if we know that kind of data specific for Gallatin County, if we know that it's mostly unvaccinated people who are, driving the hospitalizations and cases.
I don't have exact numbers for you, but I wonder if Dr. Sullivan, because he is a critical care intensivist in our critical care unit, if you've encountered any vaccinated individuals in the critical care unit who are COVID positive.
We've encountered vaccinated patients who are COVID positive, not to try to break any rules about patient privacy, but the situation, I can explain the difference is this. We had theoretically, for instance, we've had a patient who suffered trauma. When the patient was screened for COVID, he was positive, but he didn't have any symptoms of COVID, but he's very sick from his trauma.
Mm-hmm.
So technically we have a COVID positive patient who's very sick in our ICU, but that was just trauma. And he's not suffering any symptoms of COVID. So that's an incidental infection. The vaccine did its job as far as I'm concerned. On the other hand, we have had multiple sick patients, deaths, at least one death from unvaccinated people. And we have people on life support right now that are unvaccinated. We have people in ICU who are on life support yet who are unvaccinated, but if they get worse, they will be on life support. And all of those are unvaccinated. So there is just a dramatic, from our impression as healthcare providers, seeing swarms of, I shouldn't say swarms, seeing people come in with COVID positivity. Number one, the people who are coming for COVID illness are clearly unvaccinated. We get some COVID positivity in the vaccinated in people who have very little signs of COVID disease. So again, this is this phenomena of people technically have COVID infections when they're vaccinated, but they're not ill from it. And that's exactly what the data showed that the vaccine did, with the Delta, with when originally pre-Delta variant, but it's playing out with the Delta variant. So, this is what gives me hope when I think about, are we going to get overwhelmed as a healthcare system? Is what gives me great hope is the fact that we're not getting large groups of people admitted from a assisted living facility who the virus has run through, and we will get 30% of those residents in our ICU in a short amount of time. And I know that some of the assisted livings are actually screening, and they're finding COVID positivity in well-vaccinated people. So to me, that's just clearly that the vaccine is doing its job of preventing severe illness, hospitalization, and death.
I thought I need myself. I was also curious, and I know I'm probably just asking questions that I could look up on the CDC, so sorry about that. But with the Delta variant, for unvaccinated or vaccinated people, does it cause more severe illness than, I know it's more transmissible than COVID, but I was curious if it caused more severe illness as well, if you did get infected.
Does somebody else want to take this, Doug? I'm happy to take it.
No, you're welcome. Yeah.
Okay. Yeah, I actually don't, I think the question's still out and it's harder to define whether it causes more severe illness. I think it's the transmissibility that is making it having such an impact. So now as data comes out, we might find out it's more virulent. And now it's going to be, what's the really tough part is now you're trying to figure out if it's more virulent. And when you're doing public health data, you're doing it in a semi-vaccinated population. So that's going to be a confounding factor about its virulence. So I feel like I can't really answer that. All I can answer is whenever I hear people discuss this, they quickly say the virulence question is still being decided, but the transmissibility, it's more transmissible. That you just it takes a lower viral load to go from person to person.
And then I don't even know if this, like, how to phrase this question necessarily, but I know as we're going back to school and younger kids can't get the vaccine, I guess if there's any advice to give to parents who might be concerned about having their kids go back with the rise in cases. Yeah, any advice for parents or kind of ways to curb their concern?
I can certainly chime in here, and if Dr. Sullivan or Dr. Hartnett want to weigh in as well. So I think the most important thing is, especially when you have younger kids who are not eligible to receive the vaccine at this point in time, is using those methods that we have available to us. So masking when you're able, making sure you're encouraging your kids to wash your hands frequently. And those factors are important public health measures that can help prevent illness. It's also important to be vaccinated yourself. So if you're a parent or guardian and you haven't received a vaccine, getting vaccinated yourself will also help protect your children. So again, as a community too, if we're all doing our part to prevent spread by being vaccinated, it'll be more beneficial down the road so we continue to move forward toward normalcy. So again, you're going to hear us keep talking about the importance of vaccination, but also those other prevention methods like wearing a mask, washing your hands, making sure you're staying home when you're sick. Those are all ways that we can prevent disease spread in our community as well as within our families as well. Anything to add, Dr. Sullivan or Dr. Hartnett, on that one? Okay. Any other questions out there?
I think I'm good. Thank you for bearing with me and listening to my questions.
No problem. Any of the other reporters on that have questions for us today? Going once, going twice. Okay. Well, thank you again for tuning in, and I want to thank our partners for joining us today. It's always nice to hear from many voices in the community, from our partners at Bozeman Health and our partners at MSU, because this is a collective effort. We all need to stick together to get through this. So thank you for your time today, and if there's any other follow-up questions, we'd be happy to answer them later. With that, you guys have a great rest of your day. Bye-bye.
Thank you.
Thanks, Lori.